On the variants, I think the epidemiologic situation in Quebec is interesting. We have the curve of the old stump, and I'll use the Dr. Arruda, the way it's going down, the old stump. But below, the curve of the British variant is rising, and is rising quite a bit. And in the greater Montreal area, the British variant is rising rapidly. We are afraid, and we are afraid that the Montreal region is the calm before the storm. And I think it's important that you take that into account for the announcement that we will make tomorrow. On vaccination, vaccination is our weapon of massive risk reduction. And I think that this is exactly why we put those variants, and the way we deal with them is with vaccination. And this is the way that we put a lot of priority in Montreal area right now. Now, with regard to the pharmacists, I think we're very, very pleased to announce that we will work with them in the Montreal area. People will be able to be vaccinated in pharmacies. Appointments can be taken, not before, but can be taken starting March 15, and pharmacists will be complementary to whatever Danielle Works is doing. So with regards to the ages and the region, this will be complementary to our work. One quick comment also, we've received some comments that why is it different that we take, for example, in Montérégie, people that are 85 years old, and in Montreal Island we go at 70. Well, regions are different, and they're different for many reasons, and we will adjust very quickly. Hopefully we can come down on Montérégie as quickly as possible. All regions will intensify vaccination, and depending on deliveries that we get, I think we'll be able to even accelerate more, but we'll keep those news when they come in. I want to come back also on the first day of mass vaccination that we had. I want to emphasize the good work that was done by our team. I think that was quite an accomplishment. We had, I think, something like 17,000 people that got vaccinated yesterday for our first big day. I think that's good news. And of course, I think it's normal that we have few adjustments to make. I want to remind people not to come too early, because if you come an hour early, you need to be in lineup. And I suggest 5-10 minutes is sufficient, especially for elderly people. Let's make sure that you come on time, but don't wait too long. And please make sure that the people that accompany you are limited to one person. People have tried yesterday to come 3 or 4 with one person, with an elderly, and try to be vaccinated. It doesn't work. We need to respect the principle of those appointments being taken in advance.